Welcome to the highlight video of the webinar, Price Transparency and the No Surprises Act, What's Next? Presented by HealthMe. In this webinar, we will hear from medical law expert attorney Matthew Roberts, president of Power to the Patients, Marnie Jameson, and founder and CEO of HealthMe, Dr. Michael Havoc. Let's begin.
Welcome, everybody. Well, the No Surprises Act was a good idea back in 2020 when Congress passed it with bipartisan support. There are three key concepts. First, effective January 1, 2022, for insured patients, providers are banned from billing for out-of-network emergency care, and they're also banned for balance billing for scheduled out-of-network services at an in-network facility when the patient hasn't provided consent. The final big aspect of it was that for uninsured patients, which is a very deceptive definition because it includes patients who don't have insurance, but also patients who do have insurance but choose not to use it. For those folks, you're required to give, and this is everybody, patients a good faith estimate of the cost of the services provided to the patient in advance of the actual provision of the services.
We have done 3 different polls, and it is a 90% issue. 90% of Americans surveyed would like to know the price of their health care before they get it.
What really we've done is create a pricing transparency automated solution that can automate GFEs and really simplify direct pay, which provides compliance and grows revenue for your practice.
With the requirements of the NSA and the patient's desire for price transparency, the automated process of HealthMe is the perfect fit for medical practices. Let's hear more from Matthew and his legal expertise.
So what happens if you can't balance bill a patient? You've got to deal with the insurance company. And what the No Surprises Act says, they give you a period of time to try to negotiate with the insurance company of the appropriate amount. The statute and the corresponding rules and regulations talk about the use of a qualifying payment amount as being sort of the goal for what you should try to get paid. And the QPA, which you'll hear about today, is defined by HHS as generally the plan or issuer, the insurance company's median contracted rate for the same or similar service. If the provider and the insurance company cannot come up with an agreement on what the rate for the services to be provided are, there is a process called the Independent Dispute Resolution Process. And this slide comes from CMS, and it gives you the timeline for processing a dispute. And it's 113 business days. And it essentially allows the provider and the payer to both submit proposed rates, and then an independent arbitrator essentially decides. The good faith estimate, this is a little tricky because people who don't do procedures or don't routinely do emergency work have come to the understanding that this doesn't apply to them. But this applies to everybody who has a patient that either does not have insurance or is not using their insurance.
And so providers must give a good faith estimate if a patient asks for one. Practice will say, well, gosh, we don't see uninsured patients. We don't have to do this. The bottom line is everybody that calls your practice and asks for a good faith estimate, you have to provide it. It could be an in-network patient, it could be out of network, it could be anybody. Because people who are insured and in-network have the option to opt out of their insurance and pay cash.
If I have an $8,000 or $9,000 deductible, as so many people do today, maybe it's cheaper for me to get my procedure done and pay cash out of pocket if it's November and I haven't met my deductible.
This transparency rule and the enforcement of it shows that this policy is not going away. So the enforcement of the No Surprises Act is important because there can be penalties ranging from warnings to civil monetary penalties of up to $10,000 per violation, and corrective action plans. The federal government's gone to the states and said, we want you to help us enforce this. And every state of the country, except for one, has worked with the federal government to be prepared through their Department of Insurance or through their Department of Health to start enforcing this. The federal agencies, they issued a final rule in August of this year, and it's to be effective October of this year. It completely eliminated the rebuttable presumption in favor of the QPA as a part of the IDR process. So they're following the case law. They can consider the QPA, but have to select the best offer that represents the value of the items or the service under dispute. The rule also required payers to provide additional information to providers when the providers have downcoded the claim. And then they provided further details on how the IDR process should work to try to find that balance. Who are these IDRs? Okay. A lot of independent review organizations, which are already doing similar type work, have gotten certified by CMS to sign up as IDRs. And At the end of the Trump administration, they created 2 federal rules on transparency that required first hospitals to show their rate, what they charge for certain services on a public website. And then they required the insurance industry to do the same thing. The government gave out over 400 warnings in the last 18 months. And they made an example of 2 hospitals in Georgia by fining them over $1 million for 2 facilities.
And we have a data team that goes and looks at each of these hospitals. In this last survey, they looked at 2,000 of our nation's roughly 6,000 hospitals and found 16% in compliance. Patients go into this rabbit hole with a hospital and they have to give them their name and their insurance and the procedure they want and their date of birth. And the hospital does a big data grab on the patient and then gives them one price based on their plan, but that doesn't allow them to compare and shop prices, which is the whole point of the price transparency rule.
This transparency rule and the enforcement of it shows that this policy is not going away. What's next for the No Surprises Act? Well, starting January 1, 2023, there was supposed to be a good faith estimate requirement for the convening provider or co-facility or co-provider, if there are multiple providers, to provide a good faith estimate. On December 2nd or 3rd, CMS issued a very simple announcement saying they're not going to enforce that provision going forward. What else is next is I think we're going to see an attempt by Congress to change the No Surprises Act to streamline it. But there are other aspects like the good faith estimates that could be enforced and people need to be ready for it.
That was Matthew Roberts with detailed information on the current impact of the No Surprises Act and the good faith estimate. And now, Marnie Jameson with further insights on pricing transparency.
Well, thank you, Dave, for having me. We are fully 100% behind helping patients achieve their legal right to know prices before they get their care. 20% of our gross national product is healthcare spend. 1 out of every $5 you or I make goes to pay for healthcare one way or the other, even if we don't go to see the doctor. That's twice as much as the next well-established country. And 2/3 of patients say they won't seek care or they have chosen not to seek care because they're afraid of the cost. And we have 100 million Americans, that's 41% of our adult population, in medical debt. We'd have patients having the peace of mind and the certainty of the cost before they get the procedure. There's no other sector in our economy that doesn't allow the patient or the consumer to know the price of the good or service before they get it, except in healthcare.
Thank you, Marnie. To talk more about a solution to price transparency, practicing orthopedic surgeon at Ortho Collier and founder of Health Me, Dr. Michael Havoc.
Yeah, thanks to both Matt and Marnie for a great presentation. And one of my messages here is I'm a physician. I'm the founder of Health Me, but I also still practice orthopedics. My message for the last number of years, even before the Good Faith Estimate and No Surprises Act came about, is pricing transparency is good for your practice. It's good for your patients, and it'll drive revenue and simplify operations for your staff. With transparent pricing, I set my price. I set a fair and reasonable price that's agreed on both the doctor and the patient. I'm paid at the time of service. There's absolutely no cost to collect. I get to spend more time treating my patients and taking care of them instead of entering data in the computer so I can get paid. And the bottom line is my patients and staff love it. And I do too as a physician, honestly. These are my best patients. Where this kind of ties in with today's topic really is I am compliant with federal law and have been compliant with federal law for the last 3 or 4 years, even before it existed.
And Healthy Me is a great start. And I mean, they're just doing a really fine job of getting prices out there. And I want them to become the role model for providers.
The American College of Healthcare Executives queries their members every year. This year, for the first time, it is staffing. In response to this, I think even for the last number of years, we've all been looking to automate these processes. And a large percentage of our patients who get GFEs automatically sent to them actually go ahead and purchase the care, right? They can click right on a button and purchase. So you're doing the transaction and everything all in one. The government says it's going to take 1.3 hours to provide a good faith estimate. You have to get patient data over the phone. You have to maybe create a patient record. You have to gather the demographics. You need the date of birth, contact information. You have to figure out what you're going to do for this patient, then create a price, then create a GFE document. I want to stress that just giving somebody a price over the phone, that's great. And that's wonderfully transparent, but it's not a good faith estimate. It's not a CMS compliant good faith estimate. Then you must transmit this document to the patient. You need to track whether they accept it. And then you need to store this document for 6 years in the medical record or somewhere in your system. And we help practices bundle and price the majority of things they do in their practice. The patients come up with just an all-inclusive price. If you can do it in your office, we can bundle and price it for you. Patients can request their own GFEs. They can go on your practice's website, find the service they need, push a button, enter their data, and have a GFE automatically sent to them. So your staff absolutely does nothing.
It is a way to make the patient be in better control of their healthcare decision-making, is a way to reduce the overall cost of care.
Basically, we help you create a consumer-centric marketplace, digital marketplace for your practice. Specifically along the GFE, it's very menu-driven. It's very simple. The patient and can find this type of information on your website. It's available in 12 languages, which is again part of the good faith estimate we didn't talk about. You have to supply good faith estimate in the patient's first language as part of the law. They're prompted to enter their information. And when the patient clicks down here on request good faith estimate, they are instantly sent a CMS compliant good faith estimate PDF. That good faith estimate goes to the practice, the patient, and it's also stored on your practice's private HIPAA compliant database on your HealthMe dashboard. And the staff can actually instantly send these things out. So they just ask for the patient's cell phone number and they send the link, and the patient goes ahead and takes it from there and fills in their information. Up with this, I think cumbersome legislation can be solved with good technology. And I think this is an example of how we've done this.
Thank you to all of our panelists for their outstanding and practical insight. For more information on this webinar and for questions about implementing HealthMe as your direct pay solution, please scan the QR code on the screen or reach out to support@healthmedocs.com.